So now I want to highlight how to approach a patient with shortness of breath. When you're outside and you have got a scenario in which they are mentioning that the patient is having shortness of breath. So from outside, you have to make the differential diagnosis according to the age of the patient, according to the pre-existing diseases or the condition that the patient is having. So if the scenario is like sudden onset shortness of breath or chronic shortness of breath, okay, so it will be clear from the scenario. If it is sudden onset shortness of breath, then you should make your differential diagnosis like this. And my mnemonic is P3A3. P1, the first P is pulmonary embolism. The second P is pulmonary edema. And the third P is pneumothorax. Then the A3, you should keep like this: acute exacerbation of bronchial asthma, anaphylaxis, acute exacerbation of COPD, P3A3. And sometimes it is related to some medicines. So the next you can keep like medication related, and you can ask in the medication history of the patient. But if you have got the scenario like in which they are mentioning the patient is having shortness of breath like 2 months, 3 months, 4 months, or 5 months, or 6 months, so make the differential diagnosis like this. You can make the differential diagnosis from outside: obstructive airway diseases, and write down in front bronchial asthma, COPD, bronchiectasis. Then the second option is restrictive lung disease. Write down interstitial lung diseases. You can mention some of the important that you want to rule out when you go inside. So the rheumatological causes, for example, rheumatoid arthritis, SLE, systemic sclerosis, other conditions like sarcoidosis, extrinsic allergic alveolitis, and sometimes drug-induced pulmonary fibrosis or interstitial lung diseases, like today's case. So if you have this differential diagnosis in your mind, you will reach to the diagnosis. And sometimes interstitial lung disease can be without any cause, so it is idiopathic pulmonary fibrosis. The third possible differential diagnosis for chronic shortness of breath that we have to rule out is heart failure or cardiomyopathy. Then, in cases of chronic shortness of breath, we have to include other causes. For example, anemia or pulmonary hypertension cases can present with chronic shortness of breath, or the patient is having large goiter, or the patient is having upper mediastinal mass, for example, superior vena cava obstruction. Other causes you should consider bronchogenic carcinomas also. So the chronic shortness of breath you can divide into 4 groups: obstructive airway diseases, restrictive lung diseases, heart failure or cardiac causes. Then the fourth one is other causes. Okay. Then shortness of breath in childbearing age. If you have a scenario in which they are mentioning the patient in childbearing age between 18 years to maximum 45 years, so your differential diagnosis should be like this. It can be related to pulmonary embolism, and pulmonary embolism could be alone or could be in association with deep vein thrombosis, or scenario may be having features of Aplar syndrome, Behçet's disease, or pulmonary embolism due to prolonged traveling, or pulmonary embolism due to oral contraceptive pills, or pulmonary embolism could be during pregnancy or after delivery in postpartum period. So pulmonary embolism should be top of your differential diagnosis if there is scenario of female and the patient is having childbearing age. Other scenario or other differential diagnosis in this patient, you should write acute bronchial asthma, pneumonia, interstitial lung diseases, bronchiolitis obliterans, peripartum cardiomyopathy, valvular heart diseases, anemia, and structural heart diseases. So these should be the differential diagnosis of shortness of breath patient, female patient of childbearing age.
Explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.